Welcome back to Central Valley Talk. This is our special senior segment where we talk about all things for seniors. Either you're a senior now, you're about to be a senior, or maybe you're caring for a senior who needs to maybe move to their next living opportunity in their life. Maybe they're going to move to a new place and you want to find out about it and help take care of them. I am facing this thing now. I'm 61 years old. I've got to figure out a lot of stuff. When do I take Social Security? What's Medicare? I mean, what's Medicare Advantage? What's Medicare Supplement? There's all these things that I have no idea about. So we've been asking experts to come in and help educate us a little. Our guest is Diane Morales, and you're with Berg.
Yes.
It's an insurance company.
Yes.
Now, Medicare, that's what the government covers. Is that right?
Correct. So if you have worked for 10 years or more, you've been paying, if you look on your paycheck, you've been paying into Medicare.
Okay.
And so this is a benefit that you have when you turn 65. You automatically get your Medicare card, and it pays for up to 80% of your hospital or doctor visits. So
it sounds like a lot. I mean, I haven't gone to the doctor much in the last 60 years, so... But if I do go and have the big heart attack or have the cancer or fall and break my hip, 80% might not be very much compared to what's left over. That 20% could be a lot.
Right, especially if you're on a fixed income. You know, people retire, they're not working, and so it ends up being a lot of money.
Yeah, I've heard of people who had a lot of money. They retired with a lot of money, but one trip to the hospital and it's all wiped out. So.
Right, yeah.
Now, so there's a gap, the 20% gap. You can either get a supplement or
Medicare Advantage plans. So the supplemental is a type of insurance that goes through private insurance companies, and that covers the 20%, and you can get different levels that you pay out of pocket each month for those. But a lot of times those don't include for your prescription, your dental, your glasses, hearing aids, that sort of thing.
And what's the Medicare Plus or
the Medicare Advantage plans? That's your so you have your A and your B, which is Medicare, and then the D is for your prescription, and then your Plan C is all of those included, and that's your Medicare Advantage plans. And so it picks up the rest of the 20% most of the time.
Okay.
It's at a zero premium for you a month. And it includes most of the plans, not all of them, but some of the plans includes your dental, your vision, your hearing, gym memberships. It includes over-the-counter items, transportation, and that's at a zero cost to you.
I like that.
So,
I like the sound of that. Now, you said if you don't get something, you get penalized.
Correct. So if you do not get your prescription plan when you turn 65 within a certain amount of days, then every month you don't have a prescription plan, you get penalized. Yeah, and it's it can add up if you don't have it, if you don't know, if nobody has told you.
It's all a little confusing for me. When it's my time, are you going to come and explain it to me?
Yes.
Is that how it works?
So we either do...
I don't want to figure it all out. You're the expert, right?
No. We know all the different plans. So I'm contracted with Brand New Day, Alignment Health, Blue Shield, Blue Cross, Humana, Aetna, just to name a few. I can't even think of all of them that we are contracted with, and we have to get tested every year
to make sure
we know all the different plans, what's involved. We also have to be, tested through California Department of Insurance, that sort of thing. So every year we get tested, so we know.
So either we could learn it on our own, all the ins and outs, or we just call it an expert.
Right.
Do you have a fee for us?
No. So I get paid. I get paid through the insurance.
Yeah, it's free to
carriers.
talk to you. I like that.
Right. No, I don't charge you anything. And if people are out there charging you, they shouldn't be.
Right. Very good.
So but we either come to your home, and right now with the pandemic, we can do it over the phone. The insurance carriers have really been working hard to do online so that we can just send the contracts through, the internet or on your phone.
Click of a button, you sign it.
Click of a button, right. instead of us meeting you face to face, or
I
you
hate
can
to
come
say,
into
but
the
I think
office.
one of the advantages of the pandemic is we have all this stuff going now. We're all learning to do contracts with a click and send them back and do Zoom meetings and stuff like that. So
Right,
if
right.
there's any good that came from it, I think that is.
That's
so.
an advantage to it, yes.
So who should be talking to you right now?
So tomorrow starts open enrollment.
Ah.
So October 15th through December 7th. You have a window of about 7 weeks to change your plan or to add a plan if you don't have one.
So if you're over 65 now,
If you're over 65 or if if you've been disabled for over 24 months.
okay, now's the time to pick
Change.
your plan or repick your plan. Should people check their plan that they've had all along?
They should. So my clients, I reach out to them every year and I go over like their prescriptions because each plan, each carrier has different formulas for the prescriptions. So you might be paying more this year than you did last year. There might be another plan out there that has lower costs for your prescriptions or for the hospital visits or whatever it is specifically for you. So I like to go over it with my clients so that I know,
Yeah.
okay, has there been any changes in your life for this year? Sometimes people get Alzheimer's or
So if you've been on Medicare and you didn't get a supplemental plan, this is the time.
this is the time
Yeah,
to get
okay.
it.
And or if you've been on it and you had a supplemental plan, you should get it checked right now. Just check your plan.
Correct.
With an expert like you.
Correct.
And then the third question I had was,
Sorry.
what if I'm going to turn 65 next June?
Okay, so if you are turning 65 next June, you have 3 months before your birthday, you have the month of your birthday, and then 3 months after your birthday to sign up for a Medicare Advantage plan or a supplemental or
Supplemental
something.
plan.
Yeah.
Now, would I still start on Medicare on that June, mid-year?
So June 1st would, the month of your birthday, you would start with your new plan.
Okay, so if I was born on June 20th, I'd start on June 1st.
Correct.
I'd have Medicare, so.
Correct.
So somebody never had insurance their whole life, all of a sudden they have insurance, and
Yes,
you can start
yes,
going to the
you
doctor.
can start
or-
going to the doctor.
Or get some protection anyway, because
Right.
that age you start,
Right.
having some little problems here and there.
Right.
Well, I'm glad you told me all this. I
Yeah.
understand it way, way, way better.
Yeah.
And I know what I need to do is call you when I'm there. Or anybody watching. This shows it for me. It's for you viewers.
Right.
Call Brenda. No, Diana.
Diana.
Don't
yeah,
call Brenda. Diana Morales.
Yes.
And what's your number and stuff like that? Let's get that down.
Yeah, so my cell phone number is 209-614-2224.
Okay.
Or they can call it to the office, which is the number on the screen,
Okay.
which is the 559 number.
Okay. And is there a web address or anything? Or is it just better just to give you a call?
No, it's better to just give me a call. They can call me directly. And
And I said it's very embarrassing when I say the wrong name, but I'm that age where things are slipping a little.
That's okay, that's okay.
Diana Morales, Morales, Van Berg Insurance, and you could just call their local office. Is that right? The 914
Oh,
or the
no,
7?
it's 614-2224 is the cell, and it's 209.
So the first number is wrong.
Yeah.
The second number, though, is the office number.
Yes, that's 721-2311 is the office number.
23111.
Yeah, yeah,
And
yeah.
but you get Diana directly by dialing 209
209-614-2224.
Uh-huh. 2224. Okay.
Yeah.
Very good. Any last thoughts for our viewers?
No, but time is
Yeah.
of the essence to
Don't
get
call
in.
you on the last day of December, right? And say,
Right.
I don't know what to do.
Well, yeah, December 7th is the last
Oh,
day.
December 7th.
December 7th. And so when you sign up between October 15th and December 7th, the plan will take effect January 1st,
Okay.
the new plan. And all the new plans are coming out for next year.
Yeah. I'm going to tell you what I'm going to do. I'm going to keep Diana's number on my desk here at the office. And when you guys decide, oops, I better call somebody or talk to somebody, who was Mike saying I should talk to? I'll give you Diana's direct number. Is that all right?
Yes,
Direct cell
yes.
phone number. I'll give you
Yes,
the number.
yes.
And don't wait till December 7th, whatever you do.
And-
Now's the time to start talking.
And I think I was getting a few calls already.
Already? I heard your phone.
It was ready.
Your
It was
watch
ring-
rings?
My watch
That's
rings
like
from
a-
my cell phone. And I think some of my clients were calling me already right now.
That's
So.
good. They probably saw you and say, I see you on TV right
Yeah.
now. So, all right, well, thank you for coming. Thank
No,
you for
thank
educating
you.
us.
Yeah.
And maybe before this enrollment period's done, you could come back again.
Yeah, sure,
We'll take
sure.
another
No
run at
problem.
it.
Okay.
Diana Morales, helping you fill that gap between what Medicare gives you, you know, the 80%, you know, that other 20%, you need it. Plus the prescription coverage and the dental and all the other things you'll need.
Right,
We'll
right.
be
At
back.
zero cost to you.
Zero cost.
So you can't get any lower than that, zero.
We'll be back with more Central Valley Talk right after this.
Thanks.